gov.bc.ca/COVID-19. And for a full listing of the provincial health officer's orders, visit gov.bc.ca/PHO guidance. Last question is from Nick Sweetman, CHLY.
In March, fatal overdoses in BC increased by 61% compared to February. March also saw 7,000 fewer visits to overdose prevention sites and safe consumption sites. Could you tell me what's being done to increase access to OPS and SCS sites and encourage people who use drugs to visit them? And also, if you know anything about the fatal overdoses or SCS use for April and May.
Yeah, we don't have the final numbers for April and May, but this is something, of course, that I watch, and we have a weekly report that we've been looking at. There's been a whole number of factors that have led to the numbers that we saw in March, and believe me, these are important things that we have been following, and there is a plan. Some of the OPS did shut down their services, reduce their services quite a bit, particularly early on in this when we were trying to figure out how to best protect people, both the people who worked in the OPS and our peer support groups in the OPS, as well as people who use drugs in those settings, safe settings. I will also note that we still have not had any deaths at the overdose prevention site or supervised consumption sites around the province. There has been modifications that have been made that have allowed them to expand their services again. And we know that in several communities, like here in Victoria, other types of provision of overdose prevention services have been made. So they went from their one standalone place to having mobile overdose prevention services because of the way that the challenges we were having with the shelters, for example, and people being more dispersed around the province. So we've seen a number of different things. The other thing that I am very concerned about is, of course, the increased toxicity of the drugs on the street right now, and a lot of that has to do with the difficulty in getting that it's been more challenging to get some of the drugs into the province, which means that they're being cut with different things or being attempted to be manufactured within the province, and that has led to an increased toxicity, which of course is part of the tragedy that we're seeing in the last little while. So we have seen both an increase in severity, and we've seen clusters of overdoses, even when overdose prevention services were available in those areas. So it has been a work in progress. I think one of the key important things that we have been doing around, particularly around Topaz Park here and Pandora and Oppenheimer Park, is moving people into more safe shelters in where they have their own room and their own bathroom. That makes it safer for them, but then making sure that we have those overdose prevention services so people are not using alone in those settings, and that's a big challenge, as we all know. We also know that over half of the overdoses happen in young men who are using alone at home, and this is still another very challenging thing to get people to, when we're all isolating, to have somebody that they can reach out to. And I know there's been a couple of initiatives like using apps to support people who are using alone. The other thing that is incredibly important, we came out with safer supply guidance, and that has been moved out around the province to various different degrees. It's been a challenge, and that is something that we are continuing to focus on, making sure that people who use drugs are able to access safe, regulated or safe pharmaceutical alternatives to what we know is an incredibly toxic street supply. So that initiative also continues.
That's all the time we have for today. Thank you.
Thank you very much.